ask you a few questions?
Oh, sure.
Alright, can you introduce yourself?
Yeah, I'm Sam McDonald. I was a former pro guide in pro, obviously. I graduated last semester with a degree in psychology and sociology, and now I'm working as a behavioral therapist. ABA is Applied Behavioral Analysis. It's an empirically tested form of therapy for kids who have delays, socially, or even just how they are functionally. There's two different forms of it, really. There's PRT, which is Pivotal Response Treatment, and there's DTT, which is Discrete Trial Training, which is a little bit more structured. I've done both, but now I'm working in PRT. It's play-based, so it's not so rigid. A year or two ago, when I took the course ASD here over the summer with Lisa Maxfield, it was really educational, and at the time I didn't even know I was going to go into ABA for a job or anything. But I learned a lot, and at the end of the course they talked about different types of employment in ABA, and I kind of always held on to that until I was here in the psych building and I saw an ad. They were looking for behavioral therapists. So I applied, and they took me, and so that was the first company I worked at. ABA is a really big field. There's so many companies. Every time I'm on Craigslist I see at least 12 different ads for ABA therapists. Different companies have different requirements. Like, some of them you need to have already finished college. Some of them will take you if you're still in college. I've heard of companies that take you if you're in high school. But the stricter the company is about the requirements, the more likely they are to pay higher.
So what coursework do you think best prepared you for your APA position?
Let's see. Pretty much everything. My background in sociology also helped a lot because, like I said, I work with kids from all kinds of backgrounds, all kinds of areas. But for psychology, definitely developmental psychopathology was really helpful. The autism class that I spoke about earlier that I took with Lisa, child development, abnormal psychology, social psych, even statistics helped a lot because there's a lot of, every time I have session I have to collect a lot of information and then graph this information sometimes at the end of session. It's just like a lot of data collection, so research very, very much helped me. One time I was working with a little girl who, she had a really hard time attending to situations. Like, if I'd read her a book, she just, and I could tell it was probably a little bit of ADD, but it was also kind of like she would stare off into space and sort of space out for a couple seconds. And I, thought back to the class that I took where they taught me that kids who have autism tend to have seizures. And I realized she was having absence seizures, and so it turns out that she was. So it, helped her that somebody was able to spot it, because nobody else, really knew.
Yeah.
They just thought she wasn't paying attention. Yeah.
So what is required to be an ABA therapist?
Well, it just depends on the company that you're looking at. When I first started, I was working at a company that would take you if you were still in college, but you had to be pursuing something that was either psychology or social work or child development, I think. So, thankfully I was getting my degree in psych, so I was able to get that job. And then once I was at that company, I was able to get enough time in the field to get a better job by the time I graduated. So, and there's always room to grow too. Well, I work in PRT, so it's supposed to be play-based. So usually I begin and they give you a bunch of papers and the clipboard, and I kind of go through it and see what the goals are for that specific child. And for most of my kids, it's half things that they have to do, and the other half is things that they have to say. So just depending on what their goals are, I'll try to, like, for example, if they have a goal for turn taking, then most kids have like 10 different goals or more sometimes. So usually, I'll try to see what they have and then sort of see the activities that they prefer to make it something that they're interested in. And then I'll look for opportunities within that thing that they like to play to make a goal. I work with kids who are between like 18 months and my oldest one is 16. So for the babies, I have a bunch of toys that I actually bring with me that I already kind of have tried doing different goals with them, and I feel like they work very well. So if I have to prompt them to say the word on, like I have a toy that you have to turn on that I'll kind of entice them with, and then once they're into it, and they want to turn it on again, I'll like hold the part where they have to turn it on, and then you'll ask them like, what can you say? And then after doing that for a while, at first they're not happy about it because no one ever tells them to do stuff usually, and you have to keep in mind that these are all goals that most kids just kind of learn. Like usually we don't really say, oh, I'm going to teach this baby how to talk, but for them it's something that you need to like really follow through on for it to happen, because a lot of them don't ever talk, and for the ones that do, it takes a lot of time to like build up those words. So then when you prompt them like, oh, what can you say, and eventually they'll start to put it together that if they say things, they get things, and that's what behavioral therapy is. Yeah, I've got a couple that are in high school, and their goals are just how to stay on topic. Like if I'm talking about, like for example, I might have a goal where they'll say, oh, you have to talk about something that they don't want to talk about, and try to get them to talk about it with you even though it's not preferred for them. So say that my kid always wants to talk about Star Wars, but, like I'm not interested in that. So I might say, oh, I want to talk about what I did over the weekend, which was like go to Disneyland, and try to get them to just sort of focus on someone else besides them for like 10 exchanges. And then also like how to tell if somebody's bored of talking about Star Wars. Like it's tricky because it's not something you ever teach somebody. Most people it just comes naturally, like you can tell I'm bored because I'm doing this, or like I don't know, different things. Yeah. The best part is seeing for kids that didn't ever talk to see that now they are, and it makes me really happy to know that I had a big part of doing that. And even helping, parents and other caretakers to learn how to get their kids to talk so that they can keep doing that after I'm gone, makes me really happy, because a lot of these kids are 2 or 3 and they're still not talking, and then after a little bit of time having therapy they are, and it's so amazing to see that. So definitely seeing its effectiveness, which for most kids it's really fast that they start responding to it. But there's always a curve when kids first start with therapy. It's really hard for them because the big thing about it is that you have to always follow through. So if I say to do something, you have to do it basically. Like it's not going to end until you do that thing. And but once they start getting the hang of that, they learn so fast, and they get happier too because they realize it can be enjoyable, and I am there to play with them and to help them, so it's very rewarding. The hardest part of ABA, let's see, probably some of the kids that are like physically aggressive. I see so many kids that are into hitting, biting, kicking, running away, throwing stuff, really bad tantrums.
How do you deal with that?
How do you deal with that? I had to take a class to learn how to physically protect myself from the older ones. But, I mean, it's an acquired skill. At first, it was really difficult, and every time I would get hit or something, I would feel really shaken. But now, I'm really good at blocking it and knowing when it's going to happen for all of them. Like, I'm never I'm not usually surprised when aggression happens, and usually I can do something to help him calm down before it gets to that point. Like, I can see you're upset. Do you want to take 10 deep breaths? Or we do this thing called squeeze hands, which is where they like do this, and it kind of helps you to calm down. Sometimes you just have to just let them have their fit for a while, and that's also something that you learn to do, is just to ignore, which can be really difficult because, you know, it's not usually something you would do. But in therapy, sometimes you have to.
How many clients do you see per day?
Usually 3. So it's like 2 to 3 hour sessions for 3 kids.
Does that depend on age group? For example, you're a high school student. Do you follow them throughout the entire day, or is it?
Oh, for the one I see in school, I see him for 6.5 hours, 3 days a week. And he has a lot of behavioral challenges. Like, he gets really frustrated and upset, and he hits, and just everything very challenging. But I'm still beginning with him, though, so I'm hoping that will subside as he gets used to me. But it's a long time to be with one kid. That's definitely not typical because they get frustrated and annoyed. I mean, I've been with this company for about 5 months now, and I have kids that I've seen since the beginning, but some of the kids do get switched around, which is also hard because you do get attached, you know? Mm-hmm. Especially when you're the one that taught them how to deal with ABA in the first place. And for the kids who are quite small, that can be a long time of just going to session and dealing with an hour-long tantrum. Like, your whole session is just a tantrum. But then once they get through that, you feel so happy that, like, oh, I'm the one that taught them how to, you know, cope with this, and then they switch you around, and it's like, no. When I first started, the first company I was at paid $13. That is the smallest amount that you could possibly, like, get paid for this field, but they also took people who weren't finished with their degrees yet. Then when I switched, when I was almost going to get my degree because I had a lot of experience, I got about 16, and now I'm in like the 20 or so range. But I think the most you can possibly get paid for being in this field is like 25. But usually you wouldn't be doing what I do forever. You would hopefully go back to school and get your grad degree so that you can be a supervisor.
So
You should do it before you graduate with your BA, because then you'll have your BA and you'll have the experience. And that's how you make more money is, you know, I mean, it's great to have your degree. Most companies won't even look at your application unless you have a degree. But the experience is what will really set you apart, because the turnover rate for this field is very, very high. 301 really opened my eyes to all the different internships that are out there. I really feel like that's how, and also it's kind of how I started to put together like what life would look like after I graduate as far as going back to school. I just gained a lot of experience that I was able to talk about with different employers. Anyway, the project for 301 was very helpful because I was able to see, you know, how can I talk about my experiences and really analyze what I had, because at the time I didn't think I had a lot, but in the end I kind of did, and I was able to see what things I didn't have that I could get while I was still in undergrad. Like, it's a very important time to get those internships, to become friends with your professors, to work with them as either a teaching assistant or a research assistant. You have to do all those things because you can't just use this time to just get your degree and then think that there's going to be a job waiting for you. You have to be always pursuing that and thinking, what can I get now that's going to help me get that job later? Once you're in the field, it's very different than how anybody tells you it's going to be. This job is very, I don't want to say like alone, but you don't really ever see your coworkers. You're in the home with the child and a parent who's not in the room with you a lot. Like, that's the entire job. And for some people, that's not really what they're looking for, or that's not what they expected. I've definitely gotten a lot more empathy for parents who have children who are special needs.